Thank you. I'm Tom Dow with MapPath. We exist to advance novel diagnostics and therapeutics for mycobacterial disease, such as tuberculosis. The world needs a better test for tuberculosis. Our solution is a point-of-care, fingerstick, a rapid test, and we expect this to be accurate, accessible, convenient, and affordable. Our point-of-care diagnostic is a proprietary target. It's optioned to us by the University of Minnesota. By comparison, there's the time-honored TB skin test, the QuantiFERON Gold test. We stack up well, extremely well, for turnaround time, reliability, and cost. We understand there's a $1 billion global market. We're interested in the USA market. There's 13 million people infected in the US with tuberculosis. There are large customer populations, healthcare, agriculture and food service, and education. Nearly half the tests in America are done in 4 states. There are between 13 and 20 million tests, hard to get a handle on it, done each year in America. With our forecast, we have $90 for the test with a $22 margin. If we penetrate 2% of the market, that generates $23 million and a profit of 5.7. We're seeking $160,000 at this juncture as part of our pre-manufacturing budget. On our stringer, we have relationships with Bio-Techne and Heliogen. We have a team of seasoned professionals who know stuff and get stuff done. So if you're fishing for a keeper, set your hook in MapPath. Thank you.
I didn't know that I was on. All right. You mentioned that Texas, New York, you had a slide that showed key states where most of the testing is happening now. Can you tell me a little bit about who is doing the testing now versus who will be doing the testing when you're able to accomplish this rapid test? You know, it almost reminds me a bit of the rapid COVID tests that were developed.
Sure, that's our prototype, and what was elevated with COVID testing, of course, was the lateral flow assay and the broad embracement of that, and that's in our package. Certainly, immigration is a big component of those 4 states.
That's exactly.
Our consultant is a consultant for the CDC, this Dr. Thanasi, for the CDC and the VA. She helped shepherd the QuantiFERON Gold testing, and with her anticipating good results with our test, we're happy to have her as our advocate.
So you're looking at CDC, you're looking at Department of Immigration. Okay.
Sure.
All right. Thank you.
Thank you.
So you talked about a lower price point, right, compared to current alternatives. Why the lower price when when you offer such a rapid turnaround and such advantages potentially over what the current options are?
Yeah, we'd like to stand out at this point. We understand that there's going to be downward pressure on some of these. For instance, we understand Walmart is going to have clinics. CVS has the Minute Clinic. One of the reasons the TB skin test, albeit not so reliable, is the preferential test done today is that they can control the costs. And one of the reasons they control it is they cannot charge for the mandatory second visit to read the bump or no bump. So there's a lot of flexibility with the competition. So we'd like to have a price point where we stand out, not just for the turnaround time, but also the price. Yes, sir.
So you've got Bio-Techne as an interested partner or relationship, and it seems like your ask is extraordinarily small for what Bio-Techne represents.
Sure. So we have a statement of work with Bio-Techne. They did the work for the patent, and also The investigator, the inventor of the patent, was at Minnesota at the time, is now at Michigan State. He is our consultant. So the pieces are in place. We feel that this hurdle that we have at 160,000 will allow a rather quick trail. Thank you.
How defensible is the diagnostic as far as the target that the lateral flow assay is going after, and how quickly could someone else come up with something? And then you have a 10 COVID tests on the market, 10 TB tests on the market.
Yeah, this arises out of interrogating the secretome of in tuberculosis infection. To date, we have 3 targets. They're meant to be a cocktail. We have a primary target that's area under the curve, 0.96. So it's going to be hard for the next person to find that.
All right. Thank you very much.
Thank you.